Hello everybody and welcome to our video discussing the Nursing and Allied Health Medicare Advantage add-on and the GME Graduate Medical Education Medicare Advantage payment reductions and how they are impacted by Change Request 11642. So first of all, going through a little bit of a history of both of these items, the Nursing and Allied Health Medicare Advantage payment and the GME payment reduction were first created in legislation by Section 541 of the BBRA back in 1999, and then it was amended slightly in Section 512 of the BIPA back in 2000. Now, the regulation where you'll find these two issues is 42 CFR 41387. Now, note that this particular payment and the corresponding payment reduction on the GME side were effective, first of all, for cost reporting periods including portions of calendar year 2001 and on. So what happens here is that we're going to see certain qualifying hospitals that get a Nursing and Allied Health Medicare Advantage add-on payment. This also, by the way, is referred to as, in the past, it was referred to as Medicare Plus Choice, sometimes just simply HMO, Medicare Part C, but we're going to just refer to it as the Medicare Advantage for the purposes of this training. Now, we will be going through the specific qualifications of this add-on payment later on. On the other side of this, we're going to see that all teaching hospitals that have graduate medical education are going to see a reduction to the original GME payment. Now, this reduction has been in place again since 2001, and the purpose of this payment reduction was to help fund the Nursing and Allied Health add-on payment pool that we discussed above. So we're going to see all of this in more detail here. First of all, let's go through some of the qualifications for the Nursing and Allied Health Managed Care add-on payment. Number one, the provider must be receiving cost-based nursing and allied health payments in that current calendar year that relates to all or part of their cost reporting period. Now, by that I mean, just as a reminder, that assuming you do not have a 12/31 fiscal year end, then your cost reporting period is going to span 2 calendar years. And for that reason, we're going to have to take a look at the qualifications and the payment separately for each calendar year, and then add the 2 calendar years together, or portions of the 2 calendar years together, to get the amount for your particular cost reporting period. So that is the first criteria, that they must have received cost-based nursing and allied health payments. Number two, they must have received nursing and allied health cost-based payments in the cost reporting periods ending in the federal fiscal year, in other words, 10/1 through 9/30, that is 2 years prior to the current calendar year. By current, by the way, we're talking the current calendar year that we're calculating for. So again, we're going to do it calendar year by calendar year. So the current calendar year is just one of those calendar years we're looking at for part of our cost reporting period. So let's go through that again just quickly. The cost reporting period ending in the federal fiscal year that is 2 years prior to the current calendar year. So that gets a little complicated the way it's written, to make sure you grab the right year. The example that's given in this change request is that if the current calendar year is 2018, the federal fiscal year that is 2 years prior to that 2018 is 2016. So we're simply subtracting 2 years from that digit. 2018 minus 2 equals 2016. But now we're in a federal fiscal year, 10/1 through 9/30, whereas, of course, the calendar year is 1/1 through 12/31. So we're going from a calendar year to a federal fiscal year period that happens to be 2 years prior. So once you have that federal fiscal year, then you're looking for the cost reporting period ending between 10/1 and 9/30 of that particular year that we've just determined. Now, if it's a calendar year already, so if it's a calendar year, in this case, they give us the note, if the hospital's fiscal year is 12/31, then the cost reporting period ending in federal fiscal year 2016 is 12/31/15. Now, the reason for that is that the federal fiscal year is 10/1/15 through 9/30/16. 12/31/15, that ending date happens to be in that range of dates. So that's where that's coming from. I will mention we're going to be going through a form that we've developed, and it will automate that selection for you to avoid any of that confusion. And criteria 3 is that the cost report or the provider must have had Medicare Advantage utilization in that same 2 years prior cost report. We're just going to refer to that as the 2 years prior cost report. And the reason it had to have Medicare Advantage utilization is that this whole payment is based on Medicare Advantage. It's an add-on for Medicare Advantage. So regardless of what cost-based payments you have received, if you don't also have Medicare Advantage, then you're not going to be receiving a payment. Now keep in mind, if you have, let's just say you have a 630 cost reporting period, so half of your year is under one calendar year and the other half is under the next calendar year, you might qualify, let's say, for one of those and not the other. Or you might qualify for both or neither. So you have to do this calculation separately for each year to determine whether each corresponding calendar year qualifies. Once you've determined that a calendar year does qualify, then you move on to the actual payment calculation. Now again, this is completed separately for each calendar year, but obviously we're not just going to add 2 full calendar years of payments together to fit into one cost reporting period. So what we're doing is prorating each of those calendar years to determine how much of each calendar year related to this cost reporting period. In the example of the 630 that I just mentioned, it would be half of one calendar year that goes into this cost reporting period and half of the second calendar year. Now, I will mention this proration is handled by the number of months. So assuming all of your periods are full month periods rather than a mid-month beginning or a mid-month end, then this will be pretty straightforward. If it does happen to be a mid-month beginning or end, then we're just using a proration by the number of months. We're not calculating out the number of days. So that's how this will get prorated at the end. But now let's take a look at some of the detail behind the calculation. So we're going to take the cost-based nursing and allied health Medicare payments, which is basically the Medicare apportioned cost related to nursing and allied health. We will later go through the actual cost reporting references, but I just want to talk about the overview. So we'll take those cost-based nursing and allied health Medicare payments divided by the total inpatient days. Now these inpatient days are going to exclude the managed care days, so it's total except for those that were managed care to begin with. Basically this gives you a per diem nursing and allied health cost. We're going to take that per diem nursing and allied health cost and multiply it by the managed care days from the final cost report. Now these days originally would have come from the PSNR report type 118. We're going to be talking about both reopenings of existing cost reports as well as settlements of current cost reports. So if this is a current cost report that's just now going through a final settlement, then of course this data will come from the most recent report type 118. But if you're doing a recalculation of a previous cost report, it must be the original data that was used on that cost report at that time. We cannot pull more revised PSNR data if any new claims were resubmitted or anything like that. So what this gives you, this first calculation, is it essentially gives you the hospital's apportioned cost related just to managed care days. Now that doesn't mean that's what reimbursement they're going to get for this add-on payment, but it's an important factor in that calculation. So continuing on, now we're going to take a look at we're going to take that apportioned Medicare, nursing and allied health, Medicare Advantage cost, and we're going to divide it by the total nursing and allied health Medicare Advantage cost from all hospitals nationwide. Now this is the first factor that CMS calculates for us. They originally gave it to us in Change Request 2692, and then the very recent update is this 11642. So we're going to use these later factors, and that's the big change in this change request, as we'll see later. Now this gives you the provider's percentage share of the total nursing and allied health Medicare Advantage add-on payments, the percentage share of the total pool, basically. And then we're going to multiply that percentage share by the pool that's given to us in, again, both of the CRs, most recently Change Request 11642. That gives us the actual dollar amount share for that provider for that calendar year. And then again, we're going to prorate that to determine how much goes on that one cost reporting period. So this will continue the rest of this calculation here. And really the rest of it is the proration. So if we have 2 full calendar years, but we have a 630 provider, we're going to take half of the first calendar year and then half of the second calendar year and add them together to report this amount for this one cost reporting period. Again, our form that we're going to talk about later handles this for us. I'm just going through the overview of this calculation. Now here are a couple of illustrations that were given in these various change requests. So Change Request 2692 back in 2003. Here's just an example they gave us of that same calculation I just talked about. And there's a slightly different example in the new change request. The big difference we're going to see is that the factors have changed. Both that total nursing and allied health payment as well as the pool have changed depending on the year. But the math is still the same. Now, the other side of this is the funding of this add-on payment for the nursing and allied health. That comes from the GME Medicare Advantage payment reduction. Now, I will stress here that this reduction applies even for GME providers that do not have nursing and allied health. So if they receive a GME payment and they have Medicare Advantage patients, they will receive a reduction based on that, even if they do not otherwise get a nursing and allied health payment. Now, the one thing we'll see here is that these rates, the reduction as well as those 2 factors for the nursing and allied health, they were locked in at one rate initially. They were not updated every calendar year. For that reason, even though this is calendar year based and one cost reporting period might span 2 different calendar years, splitting it at the calendar year was originally kind of a moot point because it's the same percentage that was used. So that's the original way this was handled. We're going to be talking about the change here now. So now let's go through an overview of Change Request 11642. CMS issued this change request on August 21st of 2020, and below I've included a link to the actual CMS website where you can find this change request and all the full detail behind it. So this change request, as I've said before, revised really 3 different factors: the 2 nursing and allied health Medicare Advantage add-on payment factors, the pool, as well as that total Medicare Advantage cost from all hospitals. So it revised those 2 as well as the GME Medicare Advantage payment reduction itself. The original instructions were included in Change Request 2692 back in 2003. Now this change request applies retroactively, but only to cost reports that are either still open or they can be reopened, or they're under an appeal for this specific issue. It could potentially go back to calendar years 2002, all the way through 2018, and eventually forward. But again, they have to be a reopenable cost report. If you have a cost report that it's reopenable for some other issue, so it's already open for some other issue, let's say the dish payment or bad debts, that does not mean we can stick this change in there as well. It has to be separately reopenable. In other words, within 3 years of the last final settlement, NPR, Notice of Program Reimbursement, or if this nursing and allied health payment happened to be reopened for the recalculation of that, then it could be within 3 years of that settlement. But again, it has to be a valid reopenable cost report. These changes cannot be made in older cost reports that are no longer reopenable. So this payment applies prospectively as well, this payment change, and we'll see that on all the newer cost reports. And again, this form that we're going to be talking about should help you to calculate that amount for your cost report. It'll save you a lot of time there. So for cost reports that have been submitted but not settled yet, then most of the hospitals, we're going to have to just incorporate these revisions into our current processes, the normal rate review, desk review, and settlement processes. The due date that is given to MACs is March 21st of 2022. The due date specifically was 18 months of the September 21st, 2020 effective date of this change request. Now, for these hospitals, there won't be a revised tentative settlement. Now, keep in mind, a lot of the MACs have several hundred of these hospitals to revise, so that's why these 18 months were given in conjunction with all of the other workload going on right now. Now, there are certain hospitals listed on Attachment B of this change request, and basically these are providers that have had valid appeals for this issue. CMS requires these to be done first, initially, due to those outstanding appeals. Now, the instruction changes a little bit for these appealed providers. CMS does require us to do revised tentative settlements and rate reviews within 210 calendar days, and this would put it at April 19th of 2021. For the cost reports that have already been settled, so these are the ones we might need to reopen, MACs are required to reopen all reopenable cost reports, again, within 3 years of the last valid settlement, to adjust for both calculations. Now, when I say both, I'm talking the Nursing and Allied Health add-on payment as well as the GME payment reduction, assuming they both apply to that particular provider. So I said earlier that the reopenable time frame or the window is 3 years from the last original NPR or the last NPR that directly related to this issue. It can't just be some other Nursing and Allied Health issue or some other GME issue. It has to be this specific issue. Now, reopening notices went out for these providers that are impacted by this on September 18th. We had a few that went out even a few days before that. As soon as we were aware of this change request, we started identifying what providers were impacted by this reopening. Some of them were getting close to their time frame, so we issued the notices of reopening even prior to that 9/18 date. So the time frame for reopenings here. Again, most of the hospitals are going to have a due date of March 21st of 2022. That's 18 months from that 9/21 effective date. But there are those Attachment B hospitals where we have to reopen these within 150 calendar days of the effective date of this transmittal. So that puts it at February 18th of 2021. Now that assumes that it's reopenable. But if they're on Attachment B, then they're under a valid appeal. So it's either reopenable, or if it's still in an appeal, it's beyond 3 years, we would have to go through the administrative resolution process. And in that case, the time frame is 120 days instead of 150. So a slight difference there. Now, Attachment A from that change request 11642, that shows these revised factors. Now, they're not in the same order as you use them. This second highlighted one is actually the one that is used first in the calculation. That's that total cost for all hospitals, total nursing and allied health costs for all hospitals. And the second factor that you really use is the pool number. Now, what I want to mention here is this highlighting. We've added that. This was not included in the change request, but I just wanted to point out what the factors were. And of course, this last factor is the GME reduction. These 3 columns in the middle are what are used to calculate this factor right here, this middle factor, if you will. So now let's go into some more detail about how this shows up on the cost report and how we're going to calculate this. So let's start with the easy one, the GME Medicare Advantage payment reduction. The prior process for this was that the payment reduction was behind the scenes on worksheet E-4, line 30. So you would have your actual GME amount. You'd go through all the calculations to get your GME amount. And then there would be a reduction on line 30 of E-4 for those Medicare Advantage patients. In other words, what percentage was this going to be reduced? And notice there is no actual percentage listed here. It was in the instructions. It was a 14.13% reduction, no matter what year it was, and that was found in that original change request that we talked about. So this was the prior process. The new process involved a change in the cost reporting form set as well as the instructions. Now the reduction factor for those cost reports that are impacted by this change request, The new reduction factor can be found on E-4 line 29.01. That line did not exist before. But notice in this example, there still is no factor. And the reason for that is that this cost report would not have been impacted by CR 11642. So there is no flow through impact. It's not going to automatically, anytime we touch this cost report, it's not going to automatically recalculate it with the new factor. So that's something to keep in mind there. And we'll talk about the instruction that deals with that tells the cost report when to apply it and when not to. But no matter what, if you print E-4 off, you'll see line 29.01. Now keep in mind, this change is only applicable for cost reports impacted by CR 11642. So what that means is either they're not settled at all, they'd be impacted by 11642, or if they're reopenable or appealed cost reports, they would be impacted by CR 11642, and this would come into play. The factor, that 14% factor from earlier, is still going to be behind the scenes for all other cost reports. So what that means is if you have a non-CR 11642 reopening for something else, that factor does not flow through. The revised factor does not flow through. So now let's take a look at the next step of this new process. A new column of line 56 on worksheet S-2 was added, basically asking, is this cost report impacted by this CR 11642? Again, if it's a brand new cost report that hasn't been settled yet, then you would want to answer this as yes. So any newly submitted cost report, you'll want to answer this as yes. The auditors at desk review will be switching this to yes, because that determines whether that GME reduction factor changes or not. So the other thing is, of course, the reopening, that if they're being done for this change request, that will be answered as yes there. However, if you have some other reopening that's beyond 3 years, so it can't be reopened for this one issue, but maybe it's still outstanding for some other issue, that will have to be left at no, because that payment reduction, the change to it, will not flow through. There's no impact of CR 11642 that will automatically flow through. Now, this screenshot that we have here shows what happens when that cost report is answered as yes, when that line 29.01 is answered as yes. What happens here is now, yes, you still see the line 29.01 that we pointed out before, but now you'll see actual different factors coming through. Instead of 14%, it's right around 5% for these years. And we'll see the table that shows these in just a bit. So again, this will only happen if line 56, column 2 is answered as yes. The other thing that you'll see happen if you have a non-calendar year cost report is that your column 2 for the managed care days will be split into two different columns, 2 and 2.01. Because again, we need to have one factor for prior to 1/1, one factor for after 1/1 of that next year. So this will require a calendar year split for PSNR report type 118. Now this is an excerpt of the cost reporting instructions for worksheet E-4. So line 29 is the actual amount of GME related to Medicare for that particular cost reporting period. Line 29.01, that's where we start dealing with those reduction factors. So line 29.01 is a new line, and it's basically saying if line 56 of worksheet S-2 was answered as yes, again, column 2, then we're going to have to bring in these new reduction factors. And it shows the table for these reduction factors. Notice that it just goes back to 2010 in the cost reporting instructions, because the current form set is the 255210 form set. So you wouldn't have anything prior to that. If for some reason you had a really old cost report that was still reopenable or under appeal, you can go to the change request to see what those factors are. By the way, all these line references would be different under that old form set. Our form handles both form sets depending on which fiscal year end you enter, it'll show you the proper instructions, the proper references. So again, these factors are automatically entered by the cost reporting software. Line 30, it just multiplies those two amounts out, the GME by the GME reduction factor, and line 30 actually shows what that reduction is going to be. So now let's move on to the Nursing Allied Health Managed Care Add-on Payment. And the first thing I want to point out is this is unlike the GME payment. The GME payment's all automatically calculated. The payment reduction is automatically calculated. But the Nursing Allied Health Medicare Advantage add-on payment is completely off cost report. There's one line on the cost report that this is reported on, and it's the summary amount from your calculation. So it's E Part A, line 53. It's just an input number. In fact, even if you go to the cost reporting instructions, they don't really tell you much about the calculation. They just reference which change request to look at. Now keep in mind that's the old change request. We now have the new one. The cost reporting instructions just have not been updated for that yet. So for this add-on payment, because it's off cost report, it's a rather somewhat complex calculation. We have created a calculation form for providers to use. We're putting that out on our website. And it automates quite a few things. It automates the selection of the 2 years prior cost reports, so you don't have to worry about going through that crazy calculation to determine which years really apply to your cost report. It also automates the proration for cost reporting periods spanning 2 calendar years, so it figures out how much of each calendar year relates to your cost reporting period. And as I said a couple times before, our form actually revises the cost reporting references based on the fiscal year begin and fiscal year end that you enter, so it can identify whether you need the 255296 form set instructions or the 255210 form set instructions. Now keep in mind, relatively few cost reports from the old 96 form set, in other words prior to 2010, will still be reopenable, so there's not very many situations where that would be needed, but the form is still built to handle it. Now this form will be posted, actually be posted very, very soon after this YouTube video is posted. It'll be posted by mid-October of 2020, and it's going to be found on our WPS GHA website under the Nursing Allied Health topic. So you can see a screenshot. We have 2 current articles out there, and it'll be right beneath that. It'll be the 3rd one. Here I've included the link to the actual overall audit section of our WPS website. This YouTube video that we're recording right now will be linked there as well. You can also find it on our YouTube channel for the WPS GHA YouTube channel. So I'm going to go through this form, and then I'm going to be bringing it up to show you a live demonstration of some pieces of it. So with this add-on payment, first of all, it requires inputting the fiscal year begin and fiscal year end for certainly the current cost reporting period, and potentially up to 6 of the most recent cost reporting periods before that. Now, when I say input, I'm only talking about the period. The fiscal year begin and fiscal year end, 2 inputs. We don't need all the other cost reporting data yet. So the only reason for this is, and again, I say up to 6. It might not even need 6. It could potentially need only 3, and you'd be good to go. What happens is this form is going to determine which 2 cost reports, potentially 2 if you have a non-calendar year cost report, which 2 cost reports you need for your calculation. Now, the only way it would ever be more than 2 is if you have short periods, because the rule for the short periods is that if they both end in the same federal fiscal year, you're going to need both of them and add the results together for the calculation. So that's why it might choose, if you had short periods, you might get 2 for one calendar year and 1 or 2 for the next calendar year. You could potentially need up to 4 cost reporting periods. And I suppose if you had really, really short cost reporting periods and were approved for it, I suppose one of those years might need 3 even, but that's very, very rare. And we built this so that it can handle these situations. That's why it asks for potentially up to 6 most recent cost reporting periods. But as you can see in this illustration, it might only need 3. And then it'll black out the remaining rows so you don't waste your time entering a couple of things. So before we go on to the next section, I'm going to open up this form and show you an example of this. So let's first take a simple example, and I'm just going to put in a number here. By the way, it doesn't really matter if you put the dash or not for the provider number. The formulas will handle either way. And let's say we had test provider and that provider number. So let's say we're starting off with I'm just going to show the simple example right now, a calendar year cost report. So 1/1/18 through 12/31/18, that's the current year, let's just say. Now notice the first thing it asks for is the cost reporting period prior to the Excel row 5 right here. In other words, this was 12/31/18, so this one should be 12/31/17, assuming we have a full year. Now notice right off the bat it still says this cost report is not needed for this calculation, which your first one's not going to be needed. It has to be 2 years prior. So let's go to 1/1/16 through 12/31/16. Still says it's not needed. Now we move on to the 1/1/15 through 12/31/15 cost report. And notice right now it says use this for calendar year 1 entry below. And that's because it begins in federal fiscal year 16, which 16 is 2 years prior to 18 for the cost reporting period. That's where that comes from. Now, since this is a calendar year cost report, we know we don't really need to go any further. But if you're concerned, you can enter all the years in if you want. And notice right off the bat, it says my next prior year was 2014. As soon as it realizes that the next cost reporting period is not going to be needed for this calculation, then it blacks the rest of them out because it knows nothing else could possibly be needed for that. So that's one example. But let's say we had a calendar year to begin with, but then we had short periods. So let's say we had a 1/1/17 through 12/31/17 is the next year, but then the year immediately prior to that, we started having a short cost reporting. So let's say that one happened to be a 7/1/16 through 12/31/16, and then there was a 1/1/16 through 6/30/16. And then prior to that, let's say we had a 1/1, we're back to a full year, 1/1/15 through 12/31/15. So notice what happened there. It selected 2 different years. It says, hey, both of these end in federal fiscal year 2016. Notice that the 12/31/16 year ends in federal fiscal year 17, so that's not the one we want. So in this odd situation, we have half a year and then a full calendar year, but we will need to select both of these cost reporting periods. And then what we're going to do is it's going to prorate it in such a way that it's only going to take this amount, this 1/1/16 through 6/30/16, that'll be half of the payment, and it'll only take 6 months worth of this full calendar year cost report, and that'll be the other half of the payment that relates to 12/31/18. So this form will handle these situations. Now if we put in 1/1/14 through 12/31/14, right away it knows, hey, we don't need this calculation. We don't need this fiscal year in for this calculation, so don't bother entering anything else. It blacks it out. So that's how this particular form will work. And then you can go down to the rest of it, and you'll see that whichever current year cost reporting period, which by the way, it tells you now which ones were needed. And keep in mind, anything that's any of these short periods, you're going to have to add them together for that. So even though it only brings in one of the years, you know up here you're going to need all of them for this calculation. But it says nothing is needed for calendar year 2. So then we go down here to the current year cost report section. And it says enter this information from your current year cost report, which of course was 1/1/18 through 12/31/18. Now, this is just going to identify, did this provider have any sort of payment for nursing and allied health on this cost reporting period? So that's what it's going to ask for, your D Part 3 and potentially D Part 4. Now, one thing to note is D Part 3 and D Part 4, they contain other pass-through payments other than just your nursing and allied health. For that reason, CRNA is one of the big ones. If you happen to have CRNA reported on line 19 of your cost report, the CRNA, then what's going to happen, let's say if I put a 1 in there, it's going to tell you to remove all CRNA costs on this line, recalculate your cost report, and re-input the revised numbers using that revised file. So the reason for this is that we don't want D Part 3 or D Part 4 to include any of the CRNA costs, so we need to determine if there's any other pass-through, which would be your nursing and allied health costs. So that's what this is for. And then if we get down to the bottom of this, you'll see that it asks for your calendar year 1 cost report that was identified, and it'll tell you which one that is, and calendar year 2 if it's needed. It's going to be grayed out if only one cost reporting period is needed, only one calendar year is needed, then calendar year 2 will be grayed out. But the other thing, keep in mind, this will tell you, this blue note here, if you have more than one cost reporting period ending in the indicated fiscal years below, then you have to sum the indicated amounts from each of those cost reports ending in that federal fiscal year, which were identified up above, and you'll have to enter the sum of these amounts from both those cost reports in this section. So all of this information is included. When you get to the calendar year 1 payment, this is everything flows. And it only flows, by the way, when it's calculated. When everything is input, then this will flow. It won't be gray once you enter all that information there. So the first part was the qualification. Does the provider qualify? And then second is the calculation. Now down here is where the final calculation is computed. And then at the end, once you enter it, it'll show you the nursing and allied health managed care payment applicable to the cost reporting period, but just for this calendar year 1. You'll see the summary of calendar year 1 and 2 down here, assuming both apply, and it'll give you a total. This total is what ultimately is reported on E Part A, line 53. If you need a calendar year 2, you'll have that separate tab. It's identical to calendar year 1. It's just pulling data from, of course, the calendar year 2 cost report. It'll give you the same summary down here. Now, if you ever need to see the original Change Request 2692, we have a tab for that here. And if you want to see the Change Request 11642 attachment, it'll be listed here as well. Again, we added the highlights, and we also pulled in the 2001, the original amounts from the original Change Request. But these are the factors that are being used in this form. By the way, these calendar year tabs pull in the proper factor based on what calendar year you're dealing with. So they pull it from this tab right here, again, based on whichever calendar year you're in. So now let's go back to the PowerPoint and finish that out. So now that we've talked about that first part of the input tab where we're just selecting the cost reporting periods, let's scroll down and we'll talk about entering the current year cost report. We saw that earlier. And then further down, we enter the 2 different calendar years potentially related to that year. The couple of things I wanted to point out are only the yellow highlighted cells need to be entered. So if they're any other color, gray, blue especially, blue means there's a calculation of some sort. So if there are any other colors, don't try to input. In fact, if you try to, it won't let you. So it's just the yellow that require input. And of course, only the input tab requires input. The other tabs are calculated amounts. Now, just as a reminder, that second year is going to automatically gray out if it's not required, so you won't even see that. And just a couple of notes here. If CRNA amounts are included in any year on worksheet A line 20 or 19 if you're dealing with the old cost report form set, They must be removed from all impacted cost reports, with all of those cost reports being recalculated before you grab the data to input into this calculation. Now, the CRNA does not impact the payment itself, but it does potentially impact qualification, because for those years that are in question, you are required to have nursing and allied health cost reimbursement before you can be eligible for this managed care add-on payment. So that's the reason for that. The other note here is that labor and delivery days from worksheet S-3, line 32, they're now part of this calculation, and they were not part of any previous calculation. So that's another slight change that's going to be included in this form, and it's included in this change request. Finally, we get down to that last piece of the calculation, which brings everything together, brings all the inputs that you've included, it brings the pool number and the other factor from the CMS Change Request, and ultimately gives you that managed care payment that's applicable to the current cost reporting period. After it's done the proration, that's the last couple of cells, it does the proration for you, and in the end, you're going to get the amount that you need to report on that cost report. So that takes us to the end of our Nursing and Allied Health Managed Care add-on payment calculation and the end of this discussion for this change request. So thank you for your time in reviewing this information. And if you happen to have any questions on this change request or one of the reopenings related to it or this topic in general, you can send that to the email address listed below, audit.advisement@wpsic.com. And we can take a look at that and see how that applies to your particular provider. Again, the form will be updated. In fact, by the time you see this YouTube or within a day or two of it, the form will be updated and available on our website for downloading. Feel free to use that. Send it in with your cost report if you'd like, just to show how you input that amount onto the cost report. But again, thanks for your time and have a good one.